care homes are gearing up to start welcoming visitors back in. They'd been stopped to prevent the spread of coronavirus. More testing will be carried out on designated family members or friends to ensure that they haven't got the virus. And homes like the Farmstead in Lawley are putting safety measures in place. Tony Stein is the Chief Executive of Healthcare Management Solutions, which runs the Farmstead. And he's with us on The Breakfast Show this morning. Tony, good morning.
Morning, Eric. Morning, everyone.
What work are you doing then to allow visitors back in?
Right. Well, there's a lot of work. We've got 70 homes around the country and everyone's got a different solution. But the Farmstead, we've got a conservatory that we're splitting so that we can access it from inside the home, from the resident's point of view, and we can access it from outside the home from the relative's perspective. So everybody's segregated as we should be. But we can actually recommence visits in a much more sort of normal kind of environment. It won't be quite normal until we're past the coronavirus problem, but it's as normal as we can get.
Yeah, 70 homes around the country, Tony. That must have been one trying time this past few months.
It's been one of the most challenging I think any of us have ever faced. I have to say the teams in the homes. Amazing. I mean, what a year. They've put in such hard work and, turning up to work, putting themselves and putting their families at risk, of contracting the virus, particularly in the early days when nobody really had an understanding of what the consequences of that might be. They've done that brilliantly well, and they've looked after the residents incredibly well at a time when it's been very difficult for them as to miss they've missed their visits with their loved ones. So they've been making up for that internally by keeping them entertained and keeping them in touch digitally through iPads and so on. It's been a really trying year for everyone. I think everybody's getting quite tired. I think the whole public's getting quite tired of it now.
We'll persist with the line for a little bit longer. It's just not sounding brilliant at the moment. We'll have another go. Tell me how you've been faring with regular testing in the homes then.
Testing was definitely very difficult at the outset. Testing's got much better. I think it's no surprise that it's taken months rather than days to get this sorted out, but much improved. I think the bit that's worrying us now, I think, is this idea of 30-minute testing to allow visits inside the home. And where there's some trials going on around the country. I think 20 of us are involved in trials on that. It's if you can imagine a home the size of the Farmstead, I think the 66 beds, that's 132 people if they're visiting twice a week. And that's got to be managed. So it's 30 minutes before the test results come through. Keeping everybody separated and isolated until we get test results which show that they're negative is going to be a logistical problem, which I think we have to try and understand a bit better before we can get that working. But the tests for the relatives and the tests for the residents, very steady now, and we're getting the results quite quickly.
So you're going to have to. How are you going to police this then? You're going to have visiting times and bookings, aren't you?
We do. We have a system. So if relatives want to visit, they can book a slot and then they come in and it's all very, very well organised. It can't be any other way. We can't have 5 or 10 people arriving at the same time because that puts them at risk as well as puts our staff at risk. No, I mean we're all growing quite accustomed to it. It's a bit like going into the shops with a mask on. You just get used to it. It's the new normal, don't you? And the staff are very good at it. I mean, all the way through the pandemic, though, Eric, I will say that as a business, we have never stopped end-of-life visits, and we've always treated every individual resident uniquely. And so those that were really struggling with mental health issues, for example, or if they had dementia and they were really, it was a real risk to them not to see somebody, then we've done what we needed to do to arrange that. So. But it has been very resource hungry. If you can imagine, we have to isolate areas of the home. We have to clean down. We have to clean down after the visits. And as I say, we have to make sure that there's no other contact around the home. So it's both expensive and very difficult to organise. But we'll get through it.
You said you got 66 beds at the Farmstead and you got 70 homes around the country. What's your smallest and what's your biggest?
Our smallest is a little 12 bed home And that's just a beautiful little. It's just like a home from home for the individuals. It's very, very homely. The largest we've got is 107 beds. Homes generally around the country, homes tend to be in that sort of sweet spot of about sort of 55 to maybe 80 beds. That's the sort of typical size. Unless you go abroad, and then they become monstrous some places. But the secret really is, and we tend to work towards it, is trying to keep even the larger homes as homely and as less institutionalized as it's possible to get. And that comes from making smaller units and having smaller spaces and that sort of thing within the homes.
Okay, Tony,
put your
connection down for a minute. Let's cut the connection for a minute, and we'll redial you very quickly, because I just want to talk to you for a moment or two more, if we can, about vaccines. So we'll just drop Tony a minute. We tried so hard with that connection, and it was all right for a while, and then it started to dip away, didn't it? Again. Sorry about that. Let's see if he's back with us. Hello, Tony, you back?
I'm back, yeah.
Good man, right, okay. I just want to talk finally and very briefly about vaccines, because this is a game changer. It could be a game changer, couldn't it?
It could. We are looking forward to the fact that the vaccines will be rolling out to the most vulnerable, and those are our residents. And I think the problem at the moment seems to be that the first vaccine that's ready for use actually requires quite a lot of it's a very low temperature storage, which makes it logistically more difficult for us. The Oxford vaccine is one which actually can be stored at slightly higher temperatures, so makes it more usable for care homes. So I believe the NHS is going to get it first. We're going to get the Oxford vaccines when that comes out first. But of course, the whole purpose of lockdown, and a lot of people have commented on this over the past few months, is that I think the younger end say, well, it's not that dangerous, it's not a big issue. Why are we locking down? And I think we have to just look at the reality of how we protect the vulnerable in our society. And I always say, if you think about it, our staff have to look after their families, they have to go shopping, they have to circulate. And we don't need them getting it and bringing it back into the care homes or back into hospitals. So if we can protect those vulnerable people, then it completely changes the game.
All right. We're going to have to leave it there, Tony, because the phone line is breaking up again as well. And I'm awfully sorry about that. There's nothing you can do about it, nothing we can do about it. But thank you, Tony. Good to talk to you. Tony Stein, Chief Executive of Healthcare Management Solutions, which runs the Farmstead Care Home in Lawley, 66-bed care home in Lawley. They're putting the safety measures in place, getting ready to welcome visitors back into care home.